I'm Alice.
And I'm Michelle.
And we want to talk to you today about Medicare credentialing, enrolling in Medicare.
Right. If you are a provider and you want to be able to treat Medicare patients, you must enroll in Medicare to be a Medicare provider. It's whether or not you want to be participating or not participating. It doesn't matter. If you want to treat Medicare patients, you have to enroll in Medicare. And CMS puts out special Medicare enrollment forms. You can't just send them a letter saying, I want to be a Medicare provider. You have to complete the forms that CMS puts out.
That's right. And there's several different forms available. You have to make sure you fill out the right form. You have to find the right form for your situation. Usually it's several forms. If you want to be participating, there's a separate form, and electronic funds transfer is a separate form. So you need to know what you're doing when you do it.
Right.
And there's attachments to add, and you have to make sure you send it to the right Medicare office.
Right. So there's a lot involved. You got to make sure you got the right form. You got to make sure you got the right information in the right spots on the right form. You have to make sure you've got the right attachments, and you got to make sure you sent it to the right place.
And if anything is wrong, it will at least delay or deny your whole application, and you have to start over.
Right.
The big problem with that is that if you send in your Medicare application February 1st and it goes through, then they will let you pay. They will pay you for services that you rendered as of January 1st. They will give you 30 days. Well, January 2nd it will be.
Right.
They will allow you 30 days before they get your application to pay you. Well, if you've made a mistake and your application ends up getting denied and you have to reapply in June, then they're only going to pay you from May. So
Right.
you really don't want your application delayed.
Right. So basically, now that you know how you get enrolled, you've got three options, we figure. You can do it yourself, which, you just got to struggle through making sure you got the right form, you got the right information, you sent it to the right place, and then you've got to deal with the Medicare people as they're communicating with you to tell you what you need to do to fix it or what you need to add.
That's right. Or the second option is you can buy our book. We have done so many Medicare applications, we've been doing them for 12 years now, that we actually wrote a book to help people so that they can complete them correctly. So if you want to buy our book, you can do that to do it.
So if you want to try to do it yourself or you want to do it for other people, you can at least have a resource to help you through that process.
That's right. And the third option is, we've been doing them for so long that they started to call us the Medicare King.
Yep. We have done so many Medicare applications and we have gotten so good at it that we have become the king of Medicare credentialing. So, you can hire the king, which we don't actually let him fill out the application.
He just checks them over afterwards.
And make sure everybody gets enough to eat. So, whether you want to buy our book to do the application yourself, or if you want us to do the application for you, you can reach us at 1-800-490-4299, or you can go to our website at www.medicalbillinglive.com. And you can buy our book in an immediately downloadable format. Or, again, the phone number is 1-800-490-4299.
For now.